I am Dr. Udgeath Dhir, Principal Director and Head Cardiothoracic and Vascular Surgery and Heart Transplant Department at Fortis Memorial Research Institute, Gurugram. On the occasion of World Heart Day, I would like to share some insights and break some myths. There are few questions and queries which everyone has in his mind regarding what is what we are dealing with exactly in uh, cardiac care, and what are the advances in cardiac care, and what we can do to prevent heart disease. See, heart is the main organ which supplies blood to the whole body, and it speaks in its own language. We have to catch hold of that language and do the treatment at an appropriate time. What I say is treatment delayed is also treatment denied. So, on this motto, let me start. People are asking what exactly causes the blockage in the arteries. So, still till 2 years of age, we are protected. The normal arteries, I would just show it diagrammatically. The normal arteries look like this. There, it's absolutely clean. There is no plaque. And then gradually, what happens as we age, because of diet, because of blood pressure, because of diabetes, you can see the yellow streaks start appearing. And then it's the blockage which happens like this. And then ultimately it goes to the critical level. So, how does it go about? So, it is a gradual process. Like I say it, like aging is a process. Similarly, this deposition of plaques, cholesterol, and mixed happens in our arterial wall. And what are the pablum is there, but what we add to it in terms of diet, in terms of exercise, in terms of lack of sleep, in terms of excessive cholesterol, uncontrolled diabetes, tobacco, and unhealthy lifestyle leads this formation of these blockage at an accelerated rate, and they can exceed and cause critical blockage. See, we follow the principle of physics principle that till the blockage reaches a critical level, we can do normal activity without any symptoms. So what we say is till the arterial lumen is blocked around 70%, this much, we don't have symptoms. We can actually run 4 kilometers without having any symptoms. But beyond this level, we will have critical. Once it reaches the critical level, like you see, this much lumen is compromised, then we start having symptoms, and we have what we call, typically, if sudden clot formation happens because of any reason. There are multiple reasons for it. It could be inflammation, it could be viral infection, it could be stress, it could be high blood pressure, it could be uncontrolled diabetes. That leads to heart attack. So these are the few things which lead to blockage of the arteries. Last but not the least is family history. Like we inherit our features from our parents, we inherit certain traits also for this arterial. So you will see that some patients have disease at earlier age because their parents have. So what right now what we are seeing and all that is that those parents whom I operated at 60, I am getting their kids at 50. So there is a 10-year earlier manifestation and progression of the disease. There are multiple factors involved in it, but we have to control that. And how we can control it? It's by regular checkup. And that is what the motto of World Heart Day is: feel the beat. Don't miss the beat. So just be wary about your heart health and be proactive in getting your heart health evaluation. So there are various risk factors which I told you, like blood pressure, which is called hypertension, diabetes, and obesity. These are the three things I would say which in combination brings maximum strain on the heart. And these are the things which we call as metabolic syndrome or modifiable factors. We can modify and we can restrict, we can control blood pressure, we can control diabetes, and we can reduce our weight and control obesity. So these are the factors which actually we can control, and we can bring down our risk factors. So How to control blood pressure? There are, first thing for blood pressure is medication, second is exercise and sleep, and avoid any tobacco in any form, and adequate sleep. These are the four factors which we can modify and we can have a good sleep. See, people don't understand, at times the stress also leads to this. So how to de-stress ourselves? Everyone has to find his own medicine for de-stress. It could be listening to music, going to a hobby, doing a yoga, talking to your friends, or having a good time in a good company, or taking vacations. These are all important aspects in life and you should not neglect that. Second, diabetes also runs in families. So it is not, we cannot cure diabetes. Cure means if you are diabetic, you have to be on medications. Point is, don't skip your medications. Regularly measure your sugar levels. And if they are high, it's better to control. Obesity is the biggest risk factor, and it starts from the, I would say, adolescent age. That time we have to train our kids that what to eat, what not to eat, avoid junk food, use proper oil, don't use preservative foods, don't use extra salt, sleep properly. What I say is, it's a combination. What should be on your platter of diet? I say the color of rainbows, all the colors should be in your fruit or vegetable table. Avoid red meat, go for healthy diets. If you are a meat lover, go for white meats, chicken and fish. But see, follow the middle path. Excess of everything is bad. So you have to have a balanced diet. What I say is a combination of a good sleep, de-stressed life, healthy diet, and a good conversation among the places where you work and in the family, that also can lead to a heart healthy life. That is also very, and we have to train our kids that what to eat, what not to eat, because these are the things. I would say the latest thing is avoidance of preserved. Everyone right now, what I feel is, with the advent of online immediately delivery of the food, you don't like the home food, you just order on Blinkit and they get a junk food. That is not. We have to train our kids that they should have good amount of vegetables and avoidance of junk foods. This is one of the very most important aspect. And what we can do at 20 can prevent their risk factors which are going to happen at 40 and 50. So I would say this is a preemptive thing which should be taught in every schools, and I would say we should be more proactive on this. Then the third question was, what is difference between a stable angina and acute coronary? A stable angina, I told you what does angina mean. See, heart as a language. I am speaking in English. There are few people who would know, who would speak in Hindi. There would be few people who would be speaking in Tamil. There are people. So heart has its own language. How does heart speak? Heart speaks with angina. Heart speaks with increasing the pulse rate. Heart speaks with breathlessness, means you can't breathe. So these are the languages of the heart which we have to understand. So angina is the language of the heart where it is saying that I am in stress. Or stable angina means those patients, once they exert, they get pain. If they are resting normally, then they don't get pain. So during resting condition, heart says, I am all right, I am not stressed, and I am having pain. So that is angina. That is called stable angina. Stable angina, patients who have blockage less than 70%, who are on medications, and they can do their normal activity, not strenuous exercises, but they are stable on angina. These patients are called patients of stable angina. Acute coronary syndrome. Coronary is the name for the arteries. Coronary relates to the heart. So coronary artery disease, that is the disease of the heart arteries. So coronary syndrome means when there was a pablum, there was some blockage, maybe 40-50%, and suddenly clot has formed and it has led to acute heart attack. That is called acute coronary syndrome, in which the blood supply to that heart area, which can be multiple areas. Heart has three arteries, so it could be in any of the left system or the right system. And when there is a decreased blood supply leading to stress on the heart, which is compromising its heart function, that is called acute coronary syndrome. And the treatment is that you have to reach emergency. And what we say, muscle is time, time is muscle. So the intervention has to be done within first 4 to 6 hours. Earlier the better, and you can save the heart muscles. What I say is, if you save 5% of your heart muscle, you save 5 years of your life. So the heart function and muscle is the most important thing. And what we can do in such emergency situations is, we have a concoction of 3-4 tablets which we give in adequate doses, which is a combination of aspirin plus clopidogrel or Brilinta plus statins, and that we give to our patients. And we can prevent sudden deaths if we give these medication on time, and we have a success rate of more than 90-95% in such cases. So this is about. Then what are the, so I would say, what are the treatment modalities? If we get heart blockage, we have angina, we get ourselves evaluated, we have multiple tests depending on stress echo, stress thallium, and we get the coronary angiography, which is the gold standard, which tells us about the status of our arteries, how much is the blockage. And what we have seen, if the blockages are less than 70%, if we do give medications, it is equally results at 5 years, whether we go for stenting or whether we go for surgery. But once the blockage exceeds 70-75%, then we have to choose. And it depends. If you are diabetic, if you have blockage in all the three vessels, the vessels are calcified, there are blockages at multiple levels, we have a scoring system which we calculate. If the score is above 20-24, then what we say, that bypass is the answer for it. And it has been proven beyond doubt with various studies that if you have a triple vessel disease, you are diabetic, and you have a slight decrease in heart function, then coronary artery bypass grafting is more successful in terms of longevity, in terms of prevention of reintervention. By reintervention, I mean that once you go for bypass, you would not be requiring further treatments for your disease. And third, last but not the least, most productive and cost effective surgery. So it has been published in various journals that if we do this, it is more cost effective and gives a good productive life for next 15 to 20 years. With the recent advances, what we are doing right now, with the advent of, I would say, the technology, the techniques, our safer surgery results, we are doing these surgeries through minimal invasive approach, whether it's a valvular surgery, whether it's a congenital heart disease, or whether it is a coronary artery disease. We also do robotic assisted heart surgeries, in which it is not the robot which is operating. We are at one end, and with our extended arms through the robot, we have 4 arms, and we do robotic assisted cardiac surgery. What is, I would say, see, everyone cannot get a robotic cardiac surgery. It's not what I say to my patients, my shirt size is 42, his shirt size may vary, so you have to customize the treatment. Every patient is not fit for minimal invasive or robotic cardiac surgery. We have few tests, which includes the chest CT and other things. And then we say that for us, the main thing is the patient should be safe, and we should give good results, so that the patient doesn't require our treatment for next 10 to 15 years in any active form. By active form, I means reintervention. Maybe you would require a resurgery or a restenting and all that. So that can be prevented. So safety comes first, and that is one of the most important aspects, I would say. Where we are with minimal invasive approach, we hardly give, the incisions vary from 2 to 5 centimeter, and with the robots, the port, and you have a 2 to 5 centimeter incision through which we do the bypass and the valve replacements and some congenital defect closure. The patients are discharged on day 5. Their intensity of pain is less, their scar is less, and they are discharged early, they become active early. all patients, whether we do open or close, they're usually the patients are back to work in 6 weeks. They are mobilized on day 2, and they have a normal life. Only few restrictions for first 1 month is not to lift heavy weights more than 5 kgs, and avoid driving because of sudden jerks and all that. That is the only thing which we say. Rest, they can do their normal activities. And I would just share, there are few doctors whom I have operated, and their stitch removal was done on the 12th day, and 14th day he called me. He happens to be my senior. He called me, I have done 10 lap colis today. So that is the amount of confidence and work you get. There are various marathon runners, there are sprinters, there are badminton players who had undergone bypass surgery, and now they are fully active, and they are doing pretty good. See, the cardiac surgery, it is not about cardiac and all that. We have advancement in the drugs, in stenting, in minimal invasive approach, in our other fields also. We are doing minimal invasive right now. TAVRs. TAVRs is a showstopper where we do aortic valve replacement without even giving a nick anywhere. So these are the advancement, and I would say appropriate selection of the case is most important. You have to understand where the indications are. Beyond the indications, I would say it's not advisable. Everyone, a TAVR at a young age of less than 30, 40 is not advisable. You should not go for it because it has long-term implications. TAVR at 75, 80 is justifiable. So you have to customize your treatment. Don't go by what is going in your, I would just ask, because there are so many things which are going on social media. And I would say we have a lot of Google doctors as well. And with the advent of Chat GPT also, there are, I don't say these are not, AI is not a good component. It's a good component, but handled gingerly. What I say, with the electricity, you can run an air conditioner, and with the electricity, you can run a heater. So it is up to you what choice you have. So take the filtered information which comes through AI, consult your doctor, and take an appropriate decision. Right now, we are in a stage where what we say in advanced heart failure, even we do heart transplants. We have artificial hearts, which give longevity. Otherwise, what I say, if despite optimal medical management, there are few patients, the medicines don't respond. There is a limit to it. But once those resources are exhausted, we still have another set of plan A, plan B, and plan C, where we can, right from heart transplant to artificial hearts to left ventricular assist devices, which can give a productive and an active life for next 7 to 10 years with a success rate of more than 80-85%. What do I mean by success rate of 80-85%? So if we have 100 patients with the same disease and who have been given adequate medications and their heart function is compromised, and we give these treatment modalities, so out of 100, 85 patients will do fine till next 7 to 10 years. 15% of the patients will not. And how we gravitated against it, if we don't do anything, all these patients will not be doing well within a year. Most of our patients will be lost. So that is the treatment. It is the new technology. We have the latest magnetic levitation technology, LVADs, which can be used for more than 7 to 10 years without compromising on any of the activity. They can go to office, they can do their normal activities, they can work normally, they can enjoy the parties and all that. So that is what. And we are still innovating, and where we are seeing that the newer technologies in terms of medications also, preemptively, primordial prevention, what we call, one is primary prevention. Once we know that the disease is there, and we, primordial prevention means not letting happening that disease. So we are in that stage of cardiac advancements where, with the help of drugs, with the help of certain things, we are working on it, where we can prevent happening of the disease. The disease doesn't sow its seeds in our body. That is also one of the more important. But on this World Heart Day, having concluded about the modalities and all that, then there is one more topic which everyone has. What is a sudden cardiac death? There is a difference. The sudden cardiac arrest, like we see, hear in the news that someone was dancing and he collapsed. This is a sudden cardiac event. This can be electrical, this can be. So heart has three systems. One is the blood supply system, another is the electrical current system, and third is the muscle and the valve system. All these three things work in unison, and effect in one can affect the other. So we have to totally evaluate all these things. So there are certain familial diseases which can lead to sudden cardiac death, sudden clot formation in one of the major vessels. So usually what we call, it's the arrhythmia. It's a dysfunction of the current system. The current system allows the heart to beat in a synchronized manner. And once this synchrony is broken and it goes into a highest form of dyschrony, then we have what we call a sudden cardiac arrest, where the heart stops working and the patient, if not treated immediately, can lose his life within 2 minutes. So so how can we prevent it? What I say is, what mind doesn't know, eyes don't see. But we should not see everything. What we say is that mind now with the Google knows everything, but we have to be vigilant. We have to be proactive for our heart health, because that is very important. We have to start our lifestyle changes at an earlier age. We don't expect a lifestyle change at 70, 75 once we have had that disease. It should start as early as possible. And what I would say, it should start in the teens. Regular monitoring of your blood pressure, a diet control, a civilized exercise report, proper sleep, and de-stressing. Exams, career, and all that. These also have to be taken. Everyone, what I say is, we should tell the young generation, everyone has his own highway. Life is not a 100-meter dash. It's a cross country. We have to live with it, live happily with a healthy heart. Take proper care of your heart, take proper care of your family members. If you are stressed, try to speak out with your family members. Get your blood pressure done. And what I tell to my patients, see, we buy a new car or something, we have to get it service done. We never miss that date. Our body also needs one day for service, and you choose your day. It's up to you whether you choose your anniversary day or whether you choose your birthday. Get yourself evaluated by a local physician, whomsoever you want to consult. Get your evaluation done, and most of the tests are available in next 4 to 6 hours. If everything is fine, enjoy your birthday and celebrate the year and celebrate the daily. I would say it's a hard day daily. You should be always smiling. I'll just share a small thing. I do a lot of mitral valve repairs, and when we check, we have a syringe, we check and we put water in it. And the mitral valve, if we get a good smile, we say that it is adequately repaired. So even the heart valve wants a smile on our face. Heart valve wants de-stressed face, de-stressed mind. So why can't we smile? Why can't we laugh together and enjoy our life? So with this, I would say, I can speak on for long, but point is, be proactive about your heart health. Heart speaks its language. Give attention to the red flags which heart can say. It can be an increased pulse rate or a decreased pulse rate. It can be high blood pressure or low blood pressure. It can be chest pain. It can be breathing difficulty. It can be feeling that you are not feeling all right while doing some activity. So that is how the heart speaks. We have to understand its language and answer its language. See, I would say it's a beautiful, Mother Nature has made a beautiful, I would say, a computer of our body. It raises the red flag. It's up to us to catch it. So we should be proactive. And what all emergency medications I told, if you have a strong family history, diabetes, hypertension, and coronary artery disease, get yourself evaluated early. You should have those set of medicines at your place. If there is an emergency, you can use those tablets. And we have multiple examples where we have taken care of these. They had medications and we gave them appropriately, and we could save multiple lives. Together we can, and together we should. On this World Heart Day, we should take a pledge that we would train our young generation to lead a heart healthy life with modifications in their dietary and lifestyle, and avoiding of any alcohol and tobacco, a good sleep and a de-stressed life, and a regular health checkup, which is most important. So with this, I would say thank you, dhanyavad, jai hind, jai bharat.